Now we got to get to the vaccine issue. You've said publicly that you don't think a vaccine brings this pandemic to an end. Is that because you're thinking about the first vaccines that we get that are likely to have only limited effectiveness? How much of that is about just inability to get enough people to actually take it? Give us a little bit of the Dr. Jha 101 for COVID vaccines.
Yeah. All right. So I expect that this year, 2020, before the end of this calendar year, we're going to have a couple of vaccines authorized. And if we're lucky, it might be 3 or 4, but somewhere in the, let's say, 2 to 4 vaccines range. We'll start giving them out to people in early January, February. I expect the vaccines, if we're lucky, they will be 70 or 80% effective. And if we're really lucky, 50 to 60% of Americans will eventually end up getting vaccinated by May or June. And if you think about that, that's not how you bring a pandemic to a complete close. Like next July, August won't look like the July, August of 2019, but it will look meaningfully better than July, August of 2020. So I don't want to understate the value of vaccines. I think it's going to be incredibly valuable. A vaccine that's 80% effective, that 60% of Americans take, that will have a profound effect on the level of virus in the community, will make a really big difference in lots of our lives. The pandemic won't be gone. The virus won't be gone.
When a vaccine is made publicly available by the U.S., from your perspective, if you have access to that vaccine, should you take that vaccine immediately?
Yeah, so my plan is, first of all, to look at the scientific data. And if the scientific data shows it to be effective and reasonably safe, then whenever I am eligible, there will be kind of an eligibility period of,
Right.
different people will be. Whenever I am eligible, I will go get it. And I think that's what people should do. Again, this will depend a lot on the data, so I hate making recommendations until the science is clear. But if the scientific process continues with the same level of rigor and carefulness that it has been done so far, I'm not going to hesitate getting a vaccine. I'm not going to hesitate having my elderly parents get vaccinated. And as long as there's some data on kids, I'm going to not hesitate getting my children vaccinated.
And is FDA approval sufficient for the average person that isn't Dr. Jha to say, yeah, this is fine?
Yeah, so there's some great scientists at the FDA, and they generally make these decisions. And if we let them make the decision and don't have political appointees overruling them, then I think FDA approval is good enough. The problem in the last couple of months is you've seen meddling from the White House where they just start getting involved, and the FDA political appointees start really getting involved. And that, I think, undermines the confidence. As long as that doesn't happen.
So there has been some erosion in your view at this point?
No doubt about it. I think there's been a lot of erosion. I think a lot of Americans are really hesitant and have lost a lot of faith in both FDA and CDC. And I think it's going to be very important to restore that faith, because not everybody needs to be able to or can necessarily go through and evaluate all the data themselves. We've got great scientists who are supposed to do that. That's what we pay them for. And we should let them do it. And we should really let them voice their assessment, as opposed to letting political leaders decide what the right answer is.
If there's one thing that we could do differently going forward as the United States, as the U.S. government, in terms of a more effective response to this coronavirus, it would be what? What's your top recommendation?
I mean, the single biggest overriding thing is just take the virus seriously. Stop ignoring it. Every time it starts increasing, act. And literally, like, you could act by enforcing a national mask mandate. That would be great. Really ramping up testing. That'd be great. Making some smart policies about not having indoor gatherings of a certain type. That would be helpful. It almost doesn't matter. Any of those or a combination of all of those would be really helpful. The hardest thing, the worst thing that we've done is for consistently underestimate the importance of this virus, the seriousness of it. And that's what keeps getting us into trouble.